Today we'll talk about pathology that is commonly referred to the proctologist's office, and that is the pathology of symptomatic internal hemorrhoids. It must be noted that internal hemorrhoids are a normal part of our anatomy, but in some individuals over time with straining, heavy lifting, or for genetic reasons, the internal hemorrhoidal cushions enlarge to the point that they become fragile. They can start prolapsing out within the anal canal or outside of the anal canal, and this can cause issues with irritation of the skin outside the anal canal and issues with hygiene. Also, internal hemorrhoids tend to cause painless rectal bleeding because when they get enlarged and become fragile, as stool passes by, these cushions can rupture, and then the passage of stool is followed by bright red bleeding, which tends to be painless because internal hemorrhoids don't have nerves that sense pain. They have nerves that sense pressure. This is why we can actually treat internal hemorrhoids without causing significant pain. Anytime we're treating within the anal canal or we're treating outside of the anal area to the tissue around it, as would be the case with external hemorrhoids or abscesses and such, it carries a significant amount of pain. But as long as we're treating internal hemorrhoids which belong within the rectum, proximal to the anal canal, generally the nerves in that area don't sense pain, which is why the treatment of internal hemorrhoids is usually fairly painless. A common method that we utilize to treat internal hemorrhoids when they're symptomatic and when medical and conservative management fails is to perform rubber band ligation of those hemorrhoids. And basically it's a quick outpatient procedure in the office without anesthesia, where we can visualize the internal hemorrhoidal cushion that is enlarged, and we will test that area by grasping it to make sure that grasping the tissue does not cause discomfort to the individual. And as long as that tissue that is abnormal can be grasped without causing discomfort, then we go ahead and take that excess tissue and tourniquet it off by placement of a rubber band at its base. And this over the time period of a few days will cause that excess tissue to necrose, and it falls off along with the rubber band with passage of stool, and then the tissue heals over time. So after rubber banding, individuals may notice some increased bleeding per rectum, and this can happen at about 4 to 10 days after the procedure, but it should usually resolve spontaneously, and then we have the individual follow up in the office within 4 to 6 weeks. This is to allow enough time for that tissue to heal so that we can inspect and make sure it's healed and see if any further treatment needs to be done. Anatomically, there are 3 different internal hemorrhoid bunches within our body. We call them cushions, and depending upon how many of these are enlarged and fragile, you may need up to 3 treatments to take care of the internal hemorrhoidal disease.